Hi everyone, welcome back. Today we're diving into an important topic that affects many women but often goes undiscussed: vaginal prolapse. Let's take a closer look at the signs and symptoms of vaginal prolapse. Have you ever felt a weird heaviness or fullness in your pelvis? That could be a sign of prolapse. It usually feels better when you lie down. If it's persistent and interferes with your daily life, pay attention. Sometimes with prolapse, you might feel a bulge or something protruding from your vaginal opening. If you notice a bulge or feel like something's falling out, don't ignore it. It's time to call your doctor. Pain is your body's way of saying something's not right. With prolapse, pain can show up in your pelvis, vagina, or lower back. Some women experience pain during sex because of prolapse. If sex is painful, talk to your doctor. Prolapse can really mess with your pee game. You might find it hard to start peeing or feel like you can't empty your bladder completely. And those gotta go right now urges? Yep, those can be a sign too. If any of this sounds familiar, don't brush it off. Prolapse can make even the simplest bodily functions a real pain. You might find yourself straining to go or feel like you haven't quite finished. Some women even have to manually press on their vagina to help get things moving. Sometimes the protruding tissues can get irritated or develop little ulcers, leading to spotting or light bleeding. You might also notice recurrent infections or a general feeling of irritation in your vaginal area. If any of this sounds familiar, it's worth having a chat with your doctor. Anterior vaginal prolapse, or cystocele, is when the front wall of the vagina weakens and drops. Because the bladder is involved, you're likely to experience urinary symptoms like leaking or trouble emptying your bladder. If you're noticing those signs, get checked out. Posterior vaginal prolapse, or rectocele, is when the back wall of the vagina weakens and bulges. Because the rectum is involved, a rectocele often comes with bowel issues. Think difficulty pooping, constipation, and needing to help things along. Uterine prolapse is when the uterus starts to descend into the vaginal canal. Depending on how far down the uterus has dropped, you might feel a heaviness or pressure in your pelvis. Some women even notice increased pressure during their period. An interocele is when a small portion of the small intestine pushes into the vaginal wall. It can cause a feeling of pressure or a dragging sensation in your pelvis. Vault prolapse happens when the top of the vagina starts to sag downwards after a hysterectomy. The symptoms are similar to other types of prolapse: pressure, bulging, and potentially some bladder or bowel issues. Even if you've had a hysterectomy, don't assume you're off the hook. Prolapse is categorized based on how far the organs have descended. Stage 1 is the mildest form, and you might not have any noticeable symptoms, or just feel slight pressure. It's something you'll want to keep an eye on. Stage 2 is where things start to get more noticeable. You'll likely experience more obvious symptoms like bulging, discomfort, and maybe some urinary or bowel issues. You know you need to do something, but you're not sure what yet. Stages 3 and 4 are the most severe forms of prolapse. You might even see organs peeking out of your vagina. At this stage, you'll likely experience severe pain and significant problems with bladder or bowel control. If you're experiencing persistent pelvic pain or pressure, see a bulge, or have trouble controlling your bladder or bowels, it's time to call your doctor. If sex is painful, talk to your doctor. Early recognition and treatment can make a world of difference. There are lots of treatment options available, from pelvic floor exercises to devices called pessaries. In more severe cases, surgery might be necessary. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe. Prolapse can feel scary, but it's more common than you think. Listen to your body and speak to your doctor if you're having any symptoms. Stay healthy and take care.